Hello, everyone. Welcome to another episode of the Feeding Solutions podcast. Today, I have my guest is Dr. Kelsey Swope. She has a doctorate of occupational therapy. She's an infant feeding specialist and the mom of three. She is passionate about helping parents navigate infant challenges with confidence. After facing her own challenges with latching issues, tongue ties, and feeding related body tension, she dedicated her career to empower parents to understand the root cause of these challenges and address them with clear and evidence based solutions. So, welcome. Thank you
Thank
again
you.
for
I'm
being
so excited to be here.
Yes, so great to be able to share your knowledge and just have another voice out there speaking out to help advocate for babies and educate parents, empower them. So, just tell us a little bit about yourself.
I mean, you gave a great rundown, but yes, as you said, so I'm a doctor of occupational therapy. I've been treating as an occupational therapist since 2013. In that time, I've also gotten married, become a mom of three. So I have Henry is 6, George is 4, and Anna is 2. We also have a dog. Her name's Penny. Besides that, we like to do a lot of family stuff. So like taking walks, hanging out at the beach, being outside. I am a huge like no shoe supporter. So we are so thrilled to like have that nice weather back, go outside.
Mm.
If anyone knows any really good thriller books, I am a sucker for a good thriller. But I really can't make it through any movie without falling asleep. But besides like those fun small side things, as you said, I'm really passionate about advocating for parents and making sure babies can be comfortable. And that's not only during feeding, but really like throughout their full day. I did have my fair share of challenges with breastfeeding, which led me down this path. And I really think that when you have such, when you treat through your passion, it gives you such a strong purpose for what you're doing. Like now I can help parents understand the root cause of their feeding struggles and
Mm.
give them tools to make their feeding smoother, their babies more comfortable, and have a really enjoyable experience for both them and the baby. Because I think a lot of people aren't loving that newborn stage because they have a fussy baby or because things are really hard. And that is such a special time and such a special bonding opportunity that I want them to be able to enjoy it as much as possible. So,
Absolutely, absolutely. So, beyond your own personal experiences and struggles, um, as far as like your mission within the infant feeding space, what would you say is like your biggest drive?
sure. So, my mission is really to bridge the gap between what our parents currently know
Mm.
and what expert supports are telling them. Because if we can bridge that gap and make it more understandable for them and something that they're able to really implement throughout their day, they are going to get the results that they need. As we just talked about my own challenges, I felt like time and time again, I didn't get a straightforward answer or one that really made sense to me when it came to my babies. It didn't sit right with me. Like I was always left second guessing myself, second guessing what I heard. And I wanted to get more information so that I could really make a more educated decision of what I needed to do and how I needed to progress with whatever challenges we were facing. I see so many parents struggling with a variety of baby troubles, whether it's flat heads, reflux, ties, breastfeeding issues, who
Mhm.
are told that it's normal, that
Mhm.
baby's going to grow out of it. Just give it time. All of these things that are kind of, if a parent is expressing these in any type of visit or any type of setting, and they're being told, oh, no, it's normal. Oh, no, this, then I feel as though they are then experiencing shame or guilt for feeling like something is not right with their baby, right? Like, oh, you just have a happy spitter. Your baby's just going to spit up. There's something going on. Like, there's a reason for that spit up. So, we want to really, or I really want to give them a better understanding of the why. There is always a why, right? And we can work towards improving that. So, I want them to know that there are other places to turn, and that there are reasons for the challenges that they're experiencing. So, providing that evidence and providing clear, like strategic steps that they can take to guide them to help ease the discomforts or build a strong foundation for success for them and their humans as they all continue to grow together as a family.
Yeah, I think that's perfect because it is such a time of mom guilt working through like the not enoughs. And it's all new in a very vulnerable stage. And so I'm glad that you're out there helping to push families in the right direction. It's so needed for sure. So as far
Appreciate
as
it.
like your clinical experience, what strides are you seeing with infants that might be having gross motor issues, feeding issues, even like I saw a baby earlier today who is just struggling with engagement because they're just very dysregulated.
Absolutely. Yeah, we're seeing a lot of dysregulation. And it's funny because the babies that we see are obviously the ones who are having difficulties. And sometimes I think it skews your idea of what is what is typical, or, not necessarily what is normal, what is typical. But more parents and professionals, I do think, are recognizing how feeding, movement, and sensory development are all connected.
Mhm.
And I'm seeing a lot more focus from this generation of parents, which is so awesome, on proactive care. They
Yes.
want a holistic approach, focusing on their dyad.
Mhm.
They are realizing like we can do better, we can be better, we can have a better experience here. And it leads to better outcomes, and not just for feeding, but for the speech development or the motor skills or the overall regulation of the baby when they're putting it all together. And babies who are getting that support are showing so many improvements in movement and development, achieving those milestones or really engaging and playing appropriately ahead of time. And it's wild to think, and I'm going to go on a little tangent here, I think, but it's wild to think that in 2022, the CDC like completely removed crawling from their developmental milestone list, because that document is to show milestone benchmarks when they happen with 75% of children of whatever that age is.
Mhm.
And that we could not even say that 75% of babies were crawling.
Yes.
It's wild to me. So instead of us saying, like, hey, there's a delay here, or hey, your baby needs to be crawling, go get support for it, we're saying, we're just going to take it off because obviously not that many babies do it and it doesn't need to happen. But it's really not just about the physical development when it comes to crawling. Like, yes, that strengthens muscles and the joints in their arms and their legs and their stomachs, like their core.
Right.
But it's also thinking about the stability and the coordination that they're going to use by weight bearing through their hands. That's going to help them from feeding and handwriting. We
Yes.
even want to think about like visual development and sensory development, right? Like getting all those different textures on your hands and feeling the rug and feeling the hardwood floor and feeling the grass and the sand. Um, and independence, confidence, doing things on your own. I think my biggest reason and my favorite reason that I love crawling, and I will say, even if your baby does not or did not crawl before they walked, get them on their hands and their knees as much as you can afterwards, is
Right.
because it is such a big thing for brain development. It is the first chance that that brain really has the opportunity to promote communication between the hemispheres. So they're working side by side, like that right and left brain is working very side by side simultaneously when they're doing tasks, when they're grabbing things the same way, or when they're reaching with both hands, um, when they're standing on both feet. But when they are crawling and utilizing the sides of their bodies in different ways at the same time, it's the first chance that those two hemispheres are actually crisscrossing together. And it is so big to help in the rest of their life with like problem solving
Mhm.
and comprehension and executive functioning. So get your babies to crawl. Even if they're not crawling before they're walking, get them on their hands and knees. It is so important. So
Yeah.
I think I'm a little off topic there, but I'm bringing it back because like these are really proactive strides that we are seeing of people understanding that more. Um, and understanding really the different reasons for what we need to be achieving, or what is ideal for us to be seeing with our little ones. The one other reason, or there's a few reasons probably, as far as why we're needing to do more of those proactive strides rather than it just happening naturally.
Mhm.
And I think one of the biggest reasons, and something that I really educate my families about, because a lot of times I'll have grandparents that come and they're like, well, we never had to worry about tummy time. We never had to worry about, you know, getting a baby to roll or any of those other fun things that we are now focusing on. Tummy time is so important. Do this, do that. And it's because I'm like, well, your baby slept on their bellies, right? They spent so much time on their bellies.
Yes.
Um, and we now have the Back to Sleep campaign, which is huge, and I'm obviously a strong supporter of, but it was actually back to sleep, front to play. And we kind of nix the latter part of that. We forget that it exists.
Mm,
So babies aren't sleeping on their backs, they need to be playing on their bellies. And now we also have all of our new gadgets and gizmos and plenty. Everything that is, all of our containers, and we're not allowing babies to move and explore their bodies as much as we used to. So
yes.
I think there's a lot of things that are contributing to that. But I
Mm,
also think that our generation is so much more empowered than other generations to think like it can be better. I want it to be better. So this is what we're going to do. So when we think about how we are interacting with babies and getting that proactive care, I do see a lot of improvements with the gross motor skills, the play and engagement and the feeding, but it's something that we are now needing to like put that time towards,
right.
where I feel like in the past, they weren't necessarily used to doing that as much.
Right. No, for sure. Is there anything else you want to add about just like the therapeutic benefit? I feel like you touched on a lot just now, but the therapeutic benefit of seeing a provider like an occupational therapist who has training in, helping with the feeding side of things, plus the gross motor, and how those two overlap a ton.
Absolutely. Yeah. So especially from an occupational therapy standpoint, we want to look at the whole, so like the whole situation. So the whole body, the whole baby, the parents, the environment, what they're doing each and every day to help them thrive. So we're really looking at what is impacting their occupations. For now, those occupations for them are those meaningful things that they do every single day is mostly feeding, sleeping, and playing. So it's not just about latching on the bottle because then we're just focusing on their mouth. We need to focus on how their body moves. We talked a little bit about regulation, but what is impacting their ability to do what they need to do throughout the day in a way that allows them to be engaged and successful.
Mhm.
And one of my big things that I stand on is that babies don't have likes and dislikes. They
Mhm.
have, I'm comfortable or I'm uncomfortable.
Mhm. Yes.
And I think that that is so misconceived, or that we are thinking, oh, well, my baby only likes to be held this one way or over
Mhm.
their shoulder, whatever it may be. That's where they're comfortable. And when they are fussy in those other positions, they're trying to communicate with you and tell you, hey, something's going on here and I don't really like it.
Mhm.
Um, I know that a lot of people say, well, your baby needs body work or body work this, body work that. And I do really hesitate to use the word body work because it does describe certain techniques that can be used.
Mhm.
To name a few, like CST or craniosacral therapy, CFT, craniosacral fascial therapy, myofascial release. Um, but I often lean towards utilizing the words of manual therapy when I treat from an occupational therapy standpoint, because that is more of that whole body approach to improve optimal function and development. And I remember someone saying, like, body work is when something gets done to you. So
Right.
similar to having body work done on your car, the manual therapy is something that gets done with you. So
Mhm.
from us better understanding the family's needs, we can really help improve that overall function, reduce the body tension, but also improve oral function, mobility, coordination, and strength. And
Mhm.
that's going to help them when it comes to the feeding and also to just like the overall comfort of the baby.
Right, right. Yeah, that makes a lot of sense. One of the topics I talk about very often is obviously we want success in the infant stage, but we also know that this time in development is setting the framework, setting the foundation for what they'll do, how they'll function into the, school age years and beyond.
Mhm.
So, um, like as far as your intervention now, like what would you say is the most beneficial as far as like helping that child beyond just the infant stage?
I think that intervention has a lifelong impact. And I think that one of the most important things is being able to educate and empower our families on how to help with all of the different challenges and growths that they will have in the future.
Mhm.
So we can address feeding and oral function in infancy. And obviously, that will hopefully improve their feeding or their oral function as a toddler and as a child and as a teen and as an adult, by improving, jaw development and airway development and reducing risk of cavities and sensory sensitivities.
Hmm.
But it is so much more than that. I think going back to putting that the puzzle pieces together is that it's really empowering the parents to understand how to work through that next piece and what they might experience with them. I think a lot of babies who just stay in that little cradled baby position and just get loved on, which I am, please love your baby all you can, but
Yeah.
also we need to put them down and they need to get that movement, because the more that they can understand that, at an early age, the more that they are going to be successful in those movements. And even thinking about reflexes, so many people, right, they swaddle their babies, that Moro reflex, so that they can't startle. But the more that the baby is getting exposure to that, then usually the quicker they're able to integrate it and learn how their body moves without that and how they can function without that. So again, I feel like I lost your question, but intervention is so important because it helps from not only just that baby age, but it's going to help them have a more confidence, a better understanding of their body, and more success as a toddler and as a child.
Yeah, I mean, and I think that the thing that I just want to bring to light is that yes, we want the child to be successful now. Like whatever age a child comes into my world, I want to support them in the here and now, but it's we want them to be able to have the skills to move forward and then not need therapy or support again in the next couple of years. So, yeah, I mean, for sure, we that's the goal with all of this. So tell me, just looking on your social media page, you have some fun, unique ways that you incorporate lots of fun into your therapy sessions. So what are some of your favorite go-tos that you like to educate parents on that you find is a big win for their babies that might be struggling with feeding and dysregulation, that kind of stuff?
Yeah. One of my like favorite quotes is moving is living. So having, and I just mentioned it in that last question too, is like putting baby down and getting them to explore. But even when babies are dysregulated, that vestibular input for so many is so comforting. So it's similar to us sitting on a swing on the front porch, and it is just this nice little rocking back and forth. And that's how babies feel when you're giving them that input. They're like, oh, this is so relaxing. And I can smell my parent, or I can smell my, whoever it is. I can hear a heartbeat and like, wow, this is great. So being able to have that ability to get to understand what their movement needs to look like and how we're going to encourage it to make them more comfortable, have them um, really develop better and have optimal function rather than having this tightness or stiffness, or inability to move those body parts. So moving, always love moving. Besides that, favorite therapy techniques, I am really big on parent education. I love seeing my clients. I love seeing their families. I love seeing their growth. But like, my goal is to not see you. I want to be able to see you for the time needed and then say, go ahead, like have a great life, like send me pictures. I can't wait to hear your updates, but I don't want you to have to rely on me because then I'm not doing my job.
Yeah.
So really teaching parents what to look for and how to support their baby's needs on their own in a confident way. I
Mhm.
know what I want to do with my baby. I know how I'm going to do it, and I'm the best person to do that for my baby.
Yeah.
I think that is by far the most powerful tool that you can give anyone.
Absolutely. Yes, for sure. Yeah, the number I was with a mom yesterday who had one of the multiple infant training books. And I told her as we were wrapping up the session, I said, you see this right here? I said, I want you to flip it over and I want you to take what works and whatever's not working, I want you to ignore it. And
Pause it.
she just burst into tears. She's like, I like everything about this, but this is making me have such mama guilt. And I'm like, then we're not going to worry about that. There's
Yeah,
no,
we don't need that.
no.
We've got enough other stuff to worry about.
Exactly. Yeah. Yeah. So empowering and letting moms and parents know like they have everything that they need in order to make sure their child is successful. It's so very important for sure.
Yeah,
For
that
sure.
baby is yours for a reason. Like they are meant to be with you. You are meant to be with them. Like you know them better than anyone else ever. And
Yes.
you always will. And I think that that is such like a deep thing. And like, I feel all of the feels when I have even my like 6-year-old, if I get him to give me a really good hug and I'm like heart to heart with him, it hits me. Like you can feel that in your body.
Yes.
And it is so powerful.
Yeah.
So being able to help parents really experience that.
Yes, it's so important. So give us some tips. What are your valuable bits of information as an OT and a mom who's had some experience? Um, what's some things that you would like to share with the listeners?
Yeah. My first is about co-regulation. As I was just talking about, like, that heart to heart and feeling that your baby feels your feels. And if we are feeling anxious or guilty or stressed or nervous, like your baby is feeling that. And I'm holding my baby and they're not latching. And, all I want to do is get them to latch. And I'm trying to like push their head on my breast and it's not working. And I'm getting so frustrated. Your baby feels that. If you're disconnected, your baby's feeling that, right? So I think it's just taking a step back, taking a few deep breaths, and really trying to connect on a different level with your baby. Like calming yourself will help calm your baby.
Mhm.
So that is my first one. I don't think that people understand co-regulation enough as far as, but I mean, I experience it every day, with your kids, with your husband, with anyone. Like somebody walks into work and they're grumpy, and I'm like, ugh, now I should probably be grumpy too. Like I struggle to stay happy when you see other people who aren't that way.
Right.
So it hits in all different ways. And whatever, you might call that an empath behavior, but it starts way earlier than that as that co-regulation. So that's my first one. Another one that I'm really big on is especially when I give my home exercises or my stuff that I want my clients to do with their children outside of therapy. I'm like, okay, we want to do this 3 times a day. We want to do this for this amount of time. Give yourself grace.
Yes.
There is going to be a day where you're like, I know I'm only supposed to keep my kid in this
Yeah.
bouncer for 15 minutes. And
Right.
then I'm supposed to put them on the floor for 30 after that. But they're sleeping and I stink and I need to go take a shower and they're sleeping and they're comfortable and they're safe, right? And like somebody else is around. Great. You go take your shower. You
Absolutely.
can have a nice meal with your spouse. You go do what you need to do. Now, I'm not saying that we can say that every day, right? But
Mhm.
you need to give yourself grace because if we are holding ourselves to these abnormally high standards that we can't achieve, we are never going to feel a sense of accomplishment. And we're always going to feel that to strive to like do better and be better. And I think that that's something that's larger just in our nation right now and how we interact with everything, right? Grass always looks greener. We see so many things that we're like, I want that, I need that. And I just got back from Ireland a week and a half ago and like seeing the difference of like what is their happiness compared to what is our happiness over here. And that's still like a very, you know, well off country. But we think about these other places that don't necessarily have all of the things that we have. And they don't have the pressure that we have either. We put too much pressure on ourselves.
Mm-hmm.
And it takes away all of the joys of the little things.
Mm-hmm. Yes.
So
Yeah. No, for
those are
sure. Yeah.
big
So
ones.
what are some important lessons you've learned that may have stung at the time that you were going through them that maybe other parents can avoid? I know a lot of it's unavoidable, but
Yeah. My biggest takeaway or my biggest, most painful lesson is that I did not trust my own instincts.
mhm,
Um, you have these feelings and you have them for a reason.
Mhm.
uh, do your research. If you're not happy with the first response that you get, like go and get some other information somewhere else. Really do all of your research, get all of the education so that you can then make the best decision for what is best for your family. I did not trust my own instincts. I was already in OT for years before I had my third child in 2023. I knew a lot about the body, and I addressed or tried to address my feeding challenges after I had two other kids. I knew what breastfeeding felt like, and hers was not the same from the hospital, like from the get-go. I
Mhm.
brought it up in the hospital and it was kind of like brushed off. Hey, go talk to your pediatrician about it. Okay, so I get to my pediatrician appointment. They brush it off. They say, oh, it looks like it's going to be okay.
Mhm.
And instead of trying to get other information or um like trust my own instincts, I was like, okay, like they know best in this situation. I'm like, I need to Kelsey, pump the brakes, right? I tell myself that probably more than not. Long story short, girlfriend gained 5 ounces in her first month, which
Mhm.
we're supposed to be gaining in like a week.
Right.
So we weren't getting the input we needed. We weren't getting the output that we needed. She was fussy on the breast. She was falling asleep. Like there were so many signs. And that's actually what brought me here today mostly. I have had feeding challenges with all of my children, but her situation stung really hard. And I never want any other parent to feel that way.
Mhm.
And I think that being able to just advocate for it and understand that everyone has different experiences, everyone has different sets of knowledge, different things work for different people.
Mhm.
So we need to find what works for you and what works for your family. But you need to trust your gut. Like if you're thinking something's going on, don't just brush that off. Like you're feeling that for a reason. So
Yeah.
trust your gut, trust your instincts, but also do your research.
Right.
Um, because there's a lot out there I think that we are still learning so much about, right? Like every single day, I would say I try to learn something new or I try to read something new because that's the best way to grow. So
Absolutely. Yeah. Yeah. Do you have any other tidbits of information that you would want to share to parents who are maybe struggling with some feeding difficulties?
my biggest thing is that if you are having feeding difficulties, you are not failing.
Yes.
You are still doing what you need to do for your baby. It might not look the way that you expected it to look. It might not be as easy as you expected it to be, but you are not failing. Like this stuff is hard. And I don't think anyone prepares us for how challenging it can be.
Yes.
And some people have this really picture perfect experience. Great. I'm so happy for you. Right. But other people don't. And that's okay.
Mhm.
And there's an occupational therapist who I do not know. I wish I did. Her name is Katie Mary, but she has a quote that I love more than anything else, and I use it all the time. And she talks about how we want to think about our challenges as a wall. So we have this wall in front of us, and what is on the other side of the wall are the things that you want to be able to do. So you want to be able to breastfeed your baby, or you want to be able to, decrease their fussiness or help them sleep better, all of these things, or things that you want to do as a person, like whatever that may be. There's a door in this wall. It is locked. Okay. We do not know if we have the key to that door or not yet. If we have the key, we can find that key so we can help you find the root causes to what's going on with your baby. We can find out, is it because they have oral weakness? Is it because they have a tie? Is it because they have body tension? Like, what is causing this, right? And let's address that. And we found our key and we work on it. And then we stick the key into the hole and we open it up, the door's open, and we can go and do those things that we've always wanted to do. In other situations, we might not be able to find that key,
Mhm.
but we are going to bust a hole in the wall to get you to that other side. I don't care what I'm doing. If it looks the way, like I obviously didn't expect there to be a huge hole in the wall, I don't care. I'm getting to whatever that situation is that you want to be able to do, whether it's the way that we expected it to happen or not. So we need to be willing to modify or like think about maybe other ideas that we weren't necessarily planning on
Mm.
And we might need to, in turn, modify what those goals are on the other side too. But we are going to get you as close to what you want that to be as possible. But we need you to have an open mind in the process.
Such good words of advice. Good quote, good guidance for sure. Yes.
We can thank Katie for that one.
Yeah,
I ad-libbed a little, but we get the point.
that's awesome. Well, tell us where we can find you. People want to learn some tips and tricks from you. Where can we find you?
Yeah, so I am currently on Instagram and Facebook. I
Okay.
have not I have not gone into the world of TikTok. I
Yeah.
will be honest. I do not think I can control another beast. But I've been trying to be really active on Instagram. I have my Instagram, my handle is at Baby Basics OT.
Okay.
So you can go and find me there. Same thing on Facebook. I do not only, or I'm in Pennsylvania. I don't even think I said that. So I'm up in Pennsylvania. So if you're in person, I can always come see you near here. I also do global, like I do virtual visits globally. And I'm also putting the finishing touches, uploading my final videos for a course that I'm doing to really figure out like what are these root challenges that we're experiencing. And that course is going to come along actually with 2 months of full support that is going to be like online because as we talked a lot about throughout this presentation is that every baby's so unique.
Mhm.
So what might work for one baby might not work for the other. So I want to be with you every step of the way to troubleshoot and problem solve and share in your wins. That is like the biggest part. And I guess that's like my last piece of advice is please celebrate your wins. And
Yeah.
it's not maybe going to be your marathon. It might be your like 5K win. It might be that small step to your marathon. But at the end of every day, like think about something that went well or think about something that you're grateful for because we so focus or over focus on the challenges that we're experiencing. And it really takes away from the joys of you and your new family and your littles that you have.
Very good. Well, great. Well, I will get all of the details on your course to share with listeners. That's
Thank you.
wonderful. That's going to be an amazing resource. Well, thank
Thank
you
you.
so much for being with us. I really appreciate it. I know you have a full plate, and I'm grateful for your time. So, again, thank you for coming on today.
Absolutely. I'm happy to be here and I hope to see you again.
Absolute. Thank you.
Yeah, thank you.